good afternoon, everyone. First of all, let me introduce myself. I am Hanaa Wafaa, a master's student in King Abdulaziz University in Jeddah, Saudi Arabia. I'm studying the Applied Medical Science Hematology Department. I would like to thank you all for allowing me to participate in this event and to present my poster about my master research. My master research was, the subject was, does megaloblastic anemia lead to psychosis? It was a single center study from Saudi Arabia. The introduction is that incidence of the megaloblastic anemia has increased, especially for the last 2 decades, particularly in the underdeveloped country. So for that reasons, the study aims to determine the association between megaloblastic anemia and psychosis among the psychotic patients in the mental health hospital in Taif in Saudi Arabia, which was the first study of a kind performed in this kingdom. In our method, we took a 50 psychotic male patient. Their age was 48.58 plus or minus 1.7. They were recruited from the mental health hospital at Taif in Saudi Arabia. Also, in addition to that, we took 54 6-match mean male healthy control. We run the following tests, including the complete blood count, liver function test, and also the vitamin B12 folate, which was our concern. Also, in addition, we ran the C-reactive protein levels. Then all the data and result was collected from the patient as well as the control were statistically analyzed using the IPM SPSS statistic for the windows. In our result, I will talk first about the general result. In the complete blood count result, RBCs count, hemoglobin, hematocrit, as well as the platelet count and the main platelet volume and the absolute lymphocyte count, all of them were significantly lower in psychotic patients versus the healthy control, with the p-value 0.007 for the RBCs, p-value 0.002 for the hemoglobin, then p-value 0.001 for the hematocrit, and respectively, the p-value will be 0.004 and then 0.0001. And the last one is for the lymphocyte count, 0.005. So all of these, the CBC result was significantly lower in the patient than the control. In contrast, in the CBC, we have eosinophil, absolute count, and basophil percentage were significantly higher in psychotic patients than in the control, with B values 0.009 and 0.0001, respectively also. When we measure the C-reactive protein, it was also significantly higher in psychotic patients with B-value 0.003. Also, the albumin was significantly lower in the psychotic patient versus the healthy control. All of this result was because of the medicine that the psychotic patient takes. Now I will come to the main issues and the main analyte in our research, which is the vitamin B12. Vitamin B12, when we measure it, the levels were slightly lower in the psychotic patients than in the healthy group, but it was not statistically significant. As we see here in the image, the first one here is for the C-reactive protein. As we see in the patient, it was higher, significantly higher. But the vitamin B12, it was lower in the patient, but there is no statistical significance. Also, the folic acid, there was also no statistical significance for it. But however, there was significant negative correlation between the serum level for the vitamin B12 and negative symptoms and hallucination. Negative symptoms and hallucination is one of the symptoms of the psychosis. So there was negative correlation. Whenever the vitamin B12 level goes down, the severity of the symptoms will be more, with b-value 0.006 for the negative symptoms and b-value 0.036 for the hallucination. So the conclusion that we came with in our research, that the finding indicate that there is no link between the megaloblastic anemia induced by vitamin B12 insufficiency and the psychosis among the psychotic patients. But however, the low serum level of vitamin B12 can predict the severity of the symptoms in some of the psychosis signs that include the hallucination and the negative symptoms. As we see here in this picture, there were a negative correlation between the negative symptoms and the vitamin B12, and also between the hallucination and the vitamin B12. Thank you all for listening. Anyone having questions?